The diseases of esophagus that we're going to read, I have divided into two modules. In the first module, I shall be teaching you the approach to dysphagia. Why? Because when I move into the disorders of esophagus, so that you do not have a blank face when I tell you which disorders have got dysphagia to solids and which disorders have got dysphagia to solid as well as liquids. So I want the concept to be crystal clear about dysphagia. So that's why there is a separate module on dysphagia, right? So to start with, what actually is dysphagia? So dysphagia is basically defined as there is difficulty in swallowing. So dysphagia is defined as there is difficulty in swallowing, right? Next condition is, which is an extreme condition, that is known as aphasia. So it's like you cannot swallow. It's like you total inability to swallow is known as aphasia. So it's the total inability to swallow is known as aphasia. So in this case, the person is not able to swallow at all. And this can be seen in complete esophageal obstruction with any mass. So if you have a complete esophageal obstruction due to any stricture or mass, so it is seen in that condition. Next comes the odynophagia. So dysphagia was difficulty. So D for D. Whereas odynophagia is when you have pain during swallowing. So when you have pain during swallowing, that is known as odynophagia. It may be associated with dysphagia. It may be associated with dysphagia, but the reverse is not true. But the reverse is not true. What do I mean by reverse? That cases of dysphagia having odynophagia. So reverse is not true. So odynophagia can be associated with dysphagia, but it's not necessary your dysphagia would have odynophagia. Okay. Next condition is what is known as globus pharyngeus or known as globus hystericus. So such patients complain of lump in the throat. So these patients complain of lump in the throat, and this lump kind of improves with swallowing. So they complain of lump in the throat, and the patient says that the symptoms of lump in the throat, it kind of improves when they are swallowing or taking any food. So this is about the basic definitions that you need whenever you evaluate a patient of dysphagia. Next comes to, we should be knowing about the phases of swallowing. We should be aware about phases of swallowing. So this thing you have already read in your physiology lectures is just about giving a applied importance to it. So there are three phases basically. One is oral, second is pharyngeal, and third is the esophageal phase. Third is the esophageal phase. Now the phases of swelling are basically accomplished by two set of peristalsis that we see. One is known as the primary peristalsis and the other is known as the secondary peristalsis. So these are two set of peristaltic movement that you can see in your GI tract, especially the tract from the oral cavity to the esophagus. So what actually happens whenever you take a food particle? Whenever you're taking a food particle, this goes into the following oral phase. Oral phase where you have mixture of saliva, and with the help of tongue, it is propelled backward into the hypopharynx. So when it is going into the hypopharynx, every effort is taken that the food does not cause any nasal regurgitation. So whatever you have at the backside of the nasopharynx, that space is obliterated so that the food is being propelled down. So when the food is propelled down from the pharynx into the esophagus, we enter into the third phase. And here you have two sphincters. One is the upper esophageal sphincter and the lower esophageal sphincter. Now it is important for the lower esophageal sphincter to relax. It is important for the lower esophageal sphincter to relax when the food is about to reach the esophagus stomach junction. Then only the food will go inside the stomach. So maximum time LES sphincter remains in the tonic phase. Maximum time it remains in the tonic phase. Even I'll say that 99% time it is in the tonic phase. Only when you are taking the food, then it kinds of relaxes and the peristaltic movement allows the food to go from the esophagus to the stomach. So this is about the physiology of your swallowing. Now let's read what is the constituent of upper esophageal sphincter. So guys, upper esophageal sphincter has got three parts. One is the cricopharyngeus, other is the inferior constrictal muscle, and third is the proximal portion of the cervical esophagus. So you have CIP. Basically you have CIP. So you have three things. One is the cricopharyngeus, second is the inferior constrictor muscle, and third is the proximal portion of the cervical esophagus. And this is basically under the control of vagus. This is basically under the control of vagus. So you basically have a central innervation. You basically have a central innervation